Hello, I'm Dr. Wayne Halstrom. Thank you for giving me this opportunity to share with you some of the things I know and have over the past 20 years learned about obstructive sleep disordered breathing, otherwise known as snoring and sleep apnea. These are conditions that afflict millions and millions of people on a worldwide basis. I like to think of snoring as the universal language because it matters not whether that noise that we make at night is in an English-speaking household, a French, a Swedish, a Chinese, or a Swahili household. The noises are all the same. The interesting thing about snoring is that while it is extremely disruptive to relationships, more importantly, it is the first and most obvious sign of what can be a life-threatening and certainly a lifestyle-altering condition known as obstructive sleep apnea. These are very common conditions. Snoring affects 60% of men over the age of 60. There are more snorers and sleep apneas than there are people who suffer from either diabetes or asthma. It's just that it has not been identified as a major health issue until perhaps the last 25 years. Now what we know is that snoring is but the first sign of a compromised airway. The medical implications of obstructive sleep apnea can be very significant. They go from elevated risks for cardiovascular disease with heart attack. They go from elevated risk for stroke to implications in diabetes and fibromyalgia. It's important to realize that there is no human condition made better by low blood oxygen. What I'm about to share with you today will come perhaps from a little bit of a different perspective than you might have heard from other health professionals. There will be two reasons for that. One is that I'm one of us. I have been a major snorer all of my life. When I got into my 50s, I discovered that the reason I was so tired all day was not that my wife was keeping me awake with a sharp-pointed elbow, but that I was simply not getting the restorative, regenerative sleep that I require. And as a result, I started hitting things with my car. And so I'm very tuned to what happens to people who have a snoring leading into a sleep apnea event. The second thing that will be a bit different about what I will show you today is that I am a dentist. I am well versed in sleep as a diplomat of the American Academy of Dental Sleep Medicine, board certified as such. However, if you scratch me very deeply, you will find a dentist. The consensus in the world of sleep medicine is that the biggest player in this whole syndrome is the tongue and what happens to the tongue during the sleep period. The collapse of the tongue into the airway is what causes the compromise of the airway and ultimately what causes the plugging of the airway. And if it's the tongue, welcome to my world. And I hope to show you how it is that we can manage the tongue as we go through this process of explaining why there is this problem and then what it is that we can do about it. The reasons that people suffer from snoring and sleep apnea are very clear. It's basically anatomy, which is why I refer to this as the consult on the anatomy of sleep. There are three primary reasons why we have this problem. The first one is genetic. We inherit many things from our ancestors. We inherit our hair color, our eye color, among other things, but we also inherit a set of characteristics that affect us in the area where the air that passes into our body must pass. For instance, we can simply inherit a small airway here, and the airway we're talking about is a small 2.5-inch collapsible tube that we refer to as the velopharynx. It starts at the level of the wisdom teeth and extends 2.5 inches down the gullet. And when it does that, it passes right behind the anatomical creature we call the tongue. The genetics predisposes the patient to this condition. Then kicks in the second of the major reasons why we have this problem, which is aging. As we age, every set of tissues in the body loses tone. Our eyes sag a little, our chins get a little saggy, and other parts of our body don't have the same muscle tone and tissue tone that they had when we were young. As we age, then, there is a tendency for this airway, the velopharynx, to become more collapsible. It is simply a collapsible tube. The third of the evil triumvirate is weight gain. As we grow older, we tend to put on more weight. which is one of the reasons why sleep apnea sufferers have a greater problem as they grow older, because the weight has a dramatic effect upon the tendency for patients to suffer from a blocked airway. That doesn't mean that if you take off all the weight, the problem goes away, because it's only one of three major conditions. And if you suffer primarily from weight, my patients ask me, do I have to have treatment for the rest of my life? And the answer is, unless weight is the major ingredient, the probability is yes. Of the other things that predispose us to these conditions, we have things like craniofacial abnormalities, which could be a lower jaw set far back in the position as it relates to the upper jaw. In patients who have an undershot jaw where the mandible is set quite far back, what happens is we lose tongue space. And as we lose tongue space, therefore, there's a greater chance for that tongue to compromise the airway. Other factors that play into this are many and varied, and one of the most important will be the presence of lymphatic tissues, tonsils and adenoids. Children, adolescents, frequently suffer from snoring and sleep apnea primarily because the airways are plugged with large swollen tonsils. And so if we have a child who is having trouble at school, is behaviorally not where we'd like them to be, it may be that it's not just that they're a bad kid. It may be that they are not getting the sleep they require because their airway is plugged and not allowing the blood oxygen levels that they require. Blood oxygen levels are very critical to ongoing health. What happens when our blood oxygen levels drop is what creates the problems that we then see out of a sleep apnea condition.